Being a South Asian in medicine is a lot more than being yet another Dr. Patel. It's also given me this ability to use all my life experiences to add to my cultural competency, to give me yet another way to bond with patients of all types and from all different backgrounds.
It is difficult being a South Asian woman in the field because there is not that many women in surgery in general, and I'm also a minority.
One of the struggles that stands out in my head was when I was in fellowship and I was judged for what I wanted to research. I wanted to research the effect of women's hormones on the immune system. Most of the doctors thought of that as kind of a soft medical topic. They did not think that women's hormones was worth looking into. They weren't really into nutritional sciences like I was.
A particular challenge that I face as a South Asian 5 foot tall, petite, not young anymore, doctor is honestly when I'm on rounds, running rounds, and I'm at a top 5 children's hospital, I have fellows, residents, med students, nurses, pharmacists, nutritionists, all sort of quote unquote under me during rounds, and it never fails that the family will sort of hear everyone present. I'll say my comments about whether I agree or not, and then they'll look at the 6 foot tall male resident next to me and say, well, what do you think, doctor? And, now I don't have any qualms about saying I'm in charge and this is what I think, but it was definitely jarring in the beginning.
As a South Asian breast imaging radiologist, I'm able to help educate and empower women who might otherwise consider their own health a taboo. We don't prioritize women's health within the South Asian community as much as we should, and I work to change that every single day.
I love breaking the preconceived notion that as a petite South Asian doctor mom, that I don't have time for my patients, that I'm too young to be a doctor, or that I just don't know my stuff.
To be very honest with you, I never feel alone being a urologist in South Asian because there's a lot of us out there. There's a lot of South Asians that are in urology, have been in urology, or are interested in pursuing a career in urology. And I personally think that's awesome because when I was in medical school, or when I was thinking of going to medical school, the only people around me that were in medicine were either cardiologists or internal medicine doctors. So I had really no exposure to anything surgical and no exposure to anything to do with the private parts of the body. So it's cool now to see that, through discovery, through all the phases of our education, we were able to find something that we love. And for me, that's urology.
I am proud to be a South Asian female gastroenterologist in a male-dominated field.
As a woman in orthopedic surgery and as a South Asian in orthopedic surgery, I have faced a lot of feedback, or you could call criticism, within the community that I am doing man's work, or that I would never find a husband or be able to have children because I picked a specialty that was very physically demanding, as well as a very busy surgical residency. I am happy to report that I was in fact able to get married and have children. I have designed the life that I want, meaning that I am there for my husband and my children as much as I want to be, because I do own my own private practice and I operate and see patients on my terms and my hours, and I was able to design career basically because I just decided that I was going to do anything possible to make my passion a reality.
Being a psychiatrist that specializes in women's mental health is even more rewarding in the South Asian community because there's so much stigma in our community about seeking help for mental health conditions. So it's particularly important.
As a South Asian female in urology, I find that I can really connect with my South Asian patients and my co-female patients. So a lot of women want to see female doctors, and it's a privilege and honor to take care of those patients.
What it's like to be a woman in this field is, believe it or not, predominantly Caucasian white male. So I think as the generations are changing, it's shifting into a female, and now being a minority or an Indian female in this field, it's not necessarily challenging, but you definitely have to work a little bit harder to kind of prove yourself. Especially being a South Asian female, it's a topic that we just don't really talk about. It's a very taboo topic: fertility, periods, all women's health.
There are many South Asian women in the field of ophthalmology, but not yet occupying positions of leadership, and I'm hoping that's going to change soon.
In the field of allergy and immunology, I also feel very fortunate. There are actually a lot of women in that field, and there's actually a lot of South Asian women, and I feel that I've been very fortunate because in that time frame, especially when I was training, I found myself to have some great mentors out there.
There aren't a lot of female facial plastic surgeons, and there aren't a lot of people of color who are facial plastic surgeons. So as a woman of color, I am definitely in the minority when it comes to facial plastic surgeons. I think it does allow me a unique perspective in my ability to help my patients who are Caucasian as well as patients of other ethnicities. I think as a woman, I definitely bring a unique perspective to the field because most of our patients tend to be women. And so I think I can really relate to a patient's concerns from quite a personal level.
So as a South Asian in the field, I have the opportunity every day to continue to break stigmas and cultural taboos surrounding death and dying that are seen in the South Asian as well as other minority populations. And this includes within my own family as well.